Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clipboard product.
This presentation is on the anterior muscle compartment of the thigh.
As we can see on the skeleton and on the lower limb model, the thigh is located distal to the hip joint and proximal to the leg. So we can see the femur running between the hip and the knee. We have our iliac crest up here, and we can see our anterior compartment of the thigh here. So we have our rectus femoris muscle with vastus intermedialis deep to that. We have our vastus lateralis. These muscles generally cross the knee anteriorly and therefore most contribute to knee extension.
So the anterior compartment of the thigh can be thought of as the knee extensor compartment. Most of these muscles in the anterior compartment cause extension at the knee. We have boundaries. Obviously, muscles are enclosed by deep fascia. More laterally, we have that thickening of the deep fascia, that iliotibial band. Medially, we have an intermuscular septa, the medial intermuscular septa, forming a boundary, and laterally and posteriorly we have a lateral intermuscular septa, with the femur also acting as a boundary in that compartment. So we can see the anterior compartment coloured here in blue. So the common action of the anterior compartment is knee extension, with the exception of sartorius. Common vessels, we have the femoral artery and femoral vein in the anterior compartment, and common innervation, the femoral nerve innervating this compartment. So in the anterior compartment, we can see here we have 1, 2, 3, 4 muscles anteriorly, making up the quadriceps. And the fifth muscle, the sartorius, is a hip flexor. It crosses the hip anteriorly, so it's going to cause hip flexion. And it crosses the knee posteriorly. It attaches in that pes anserinus area, or goose's foot. So it's going to cause knee flexion. So hip flexion, knee flexion, as well as rotation. So sartorius actually comes from the word sartor, which means tailor. And tailors would usually sit with their knees crossed or legs crossed. So it's doing that movement. It's crossing your lower limbs. The other 4 muscles, 1, 2, 3, 4, are quadriceps. It means they have 4 heads. So rectus femoris, rectus meaning straight up and down. It also crosses the hip joint. So we can see the head of the rectus femoris crossing the hip joint. So it also causes hip flexion. But all 4 quadriceps crossing the knee joint anteriorly, blending with that quadriceps femoris tendon and patellar tendon or ligament to cause knee extension. Sartorius, of course, crossing posteriorly for knee flexion. Deep to the sartorius in this subsartorial or adductor canal, we can see we have the femoral artery, femoral vein, as well as a couple of branches of our femoral nerve. We have anatomical spaces in the anterior compartment. Here we have the femoral triangle. So the boundaries superiorly, we have the inguinal ligament. Laterally, we have the sartorius muscle. And medially, we have the adductor longus. The floor, being the deepest part, will be our pectineus and iliopsoas muscles, and the roof, being the most superficial, will be our fascia lata, or that deep fascia of the thigh, with hypodermis and skin superficial to that. We have a femoral nerve, artery, vein, and lymphatics in that order from lateral to medial, and some people like to remember navy or navel. And if you remember from medial to lateral, you might like to think of vein, artery, nerve. So from lateral, we have a femoral nerve, femoral artery, and a femoral vein. Superiorly, we have an opening, the opening deep to the inguinal ligament. It doesn't have a fancy name, it's just the opening deep or under the inguinal ligament. It opens into the adductor canal or subsartorial canal. And like all anatomical spaces, its function is communication. It's just acting as a pathway for stuff to go through. Now, a subsartorial canal, you can see it's deep to sartorius, so it's subsartorial. It's also running along our adductor, so it's sometimes called the adductor canal. You can see the lateral boundary. Lateral boundary is vastus medialis. Posterior boundary will be adductor longus and adductor magnus. And the medial boundary, which is also the roof when you look at it three-dimensionally, is going to be sartorius. The contents, of course, will be our saphenous nerve, our femoral artery, and our femoral vein. So the adductor canal, superiorly, it follows on from the femoral triangle. So it opens into the femoral triangle. Inferiorly, we're entering into the popliteal fossa, which is the space behind the knee or posterior to the knee, and it enters there through the adductor hiatus. And like all anatomical spaces, its function is simply communication. It's just acting as a passageway for stuff to communicate or travel from one region to the next. Using the information you have learned in the preceding clip, fill in this table. So looking at the muscles of the anterior compartment, list their origin and insertions, their innervation and blood supply, the joint or joints which they cross, where they cross relative to this joint, and actions they might have at this or these joints. As usual, put your answers on the forum and discuss. Thank you.